incredibly happy to be here. We have an outstanding panelist of injectables today. And of course, thank you for your patience. And once again, everyone will definitely receive that $50. We're looking forward to your questions in the chats. We're looking forward to explain the artistry of injectables. And we're also going to go ahead and go through introducing everyone. All right, so up first is Miss Amber Lester. Tell us a little bit about yourself, and thank you for trying to figure everything out.
I tried. So I'm Amber. I am a doctorate prepared nurse practitioner at the Novu Skin Denver location. I've been here since October. Been practicing aesthetics for a few years, practicing as a nurse practitioner for about 7 years, but overall healthcare experience 20 years.
Okay, hi Paloma. My name is Katie. It is a pleasure to speak to you. We're so excited to have you. Tell us a little bit about yourself and how did you get into loving aesthetic injectables?
Likewise, thank you, Katie. So I started off in critical care at a level 1 ICU. And after about a year and a half of working there, I decided to pursue aesthetics once again. And I fell in love with aesthetics just from following my mom along at her appointments. So that's really how my love for aesthetics initially started. But it is very gratifying meeting new clients, having new faces in the chair, and helping each individual client achieve their aesthetic goals.
That's wonderful. We're incredibly happy to have you. Jay, once again, at the bottom left-hand corner of your screen, there's a little mic. You can press that. If you're there, say hello to us. My name is Katie. There's Jay.
I'm trying to, to figure out what happened with my video. I can share my video with you guys. But you can see my face, but a little bit of me. I'm a foreign doctor. I'm originally from Venezuela. I'm a ear, nose, and throat doctor in my country, and I'm a nurse practitioner licensed in the US, and I've been working with Novo Skin for the last year and a half, doing injectables since I was like 28. I'm a little bit older now, 42. So a little bit of experience, trying to make people beautiful and help them to get more confident and just with their self-esteem and just try to make people happy.
Yes, absolutely. We don't sell injectables, we sell confidence. I'm with you. Anyway, so my name is Katie. I'm a triple certified master esthetician, registered advanced esthetician, certified medical esthetician, and also a lowly CMA and phlebotomist. But it is my absolute pleasure to bring my personality to each of y'all. Thank you so much once again for your patience. We're going to go on and talk a little bit about Novu Skin Spa. So about our med spa, Novu is the leading wellness and aesthetic members with over 5,000 plus members and 20,000 plus satisfied customers in Las Vegas, Denver, and Frisco. We specialize in personalized treatment, and we have a proven success record with over 250 successful treatments, showcasing our commitment and proven results and client satisfaction. All right, so today we have a few things to talk about. Here's the overview for what we're gonna go over. One, we're gonna understand the difference between Botox and filler. I know that this one is a big, issue with understanding the difference between those two. They're like, well, I get these questions all the time, believe it or not. We're going to go over choosing the right treatment. We're also going to look at the PDO thread lift advantage, harnessing the power of platelet-rich plasma, or PRP, sculpting your silhouette with Sculptra butt lift, review the weight loss industry, talking about semaglutide and skinny shots, good results versus bad results, and what makes a great cosmetic injector, like the panelists today. And of course, stay tuned for your chance to win up to 400 units of Dysport. And of course, everyone participating, thank you so much for remaining on the session, $50 towards injectables of your choice. And then of course, at the very end, please feel free to hop in that chat. I do have the Q&A open, so I am monitoring it. Instead of raising your hand, go into the Q&A for me, pretty please. And we will start going over different questions either at the end, or if it's a great one that pertains to the slide, we'll stop right then and do it then, okay? All right, so I'm gonna go in kind of a revolving. We're gonna start, well, here's the giveaway. $50 towards injectables of your choice, and one grand winner was up to 600 units of Dysport. All right, so we're gonna start out with Jay, if you're ready, understanding injectables. We're gonna go with, what is the difference between Botox and filler?
So that's a good question, because like basically every single day when I have a client, a new client in my office, they think, or they have the false belief that Botox is actually the fillers. They're gonna feel any creases on their face, on their skin, or something like that. And I always make sure to explain to them what a Botox does is only going to relax, the muscles, and it's going to prevent the movement, and it's gonna, make the creases to go away. It's just an easy way to explain that to the clients, because, well, I don't think for their understanding, we don't need to go like too deep in explanation, just to make it easy for them to understand what is the difference between they both, And the fillers is just hyaluronic acid, like the name says filler, because it helps to fill the space, the empty spaces. And it's just hyaluronic acid, which is gonna push your body to build more collagen, and it's gonna just, I mean, they're gonna see the results right away. But it fills the spaces, the empty spaces, filler. But Botox is only going to relax muscles. It's not gonna fill any empty space on your face or on your body.
Perfect. So I like to describe it as there's extrinsic and intrinsic factors. So internal factors would be something like muscle movement, where Botox can help to diminish that. And then filler would be something that we can recontour the face when we're missing volume, different things like that. So over to Miss Amber, I'm going to go ahead and go to the next slide. Do you have any, tell us a little bit about this Botox for me, and why the treatment is right for you, or right for everyone, is what I think.
I'm sorry, say that again. You said Botox?
Yeah, Botox or any type of botulinum toxin.
Okay.
Tell us a little bit about it, what it's good for. I know people can use it for like headaches. They can use it
Absolutely.
for lots of different things. TMJ. So we've got Botox, Dysport, Xyman. There's lots of different. So just kind of dive into what a neuromuscular modulator is for us.
Awesome. So I don't have a favorite. I love all three of the different neurotoxins that we provide at Novu. I thoroughly enjoy treating migraine management, and whenever consulting with a client, especially that have complaints about migraines or TMJ, and it can be extremely difficult to see a neurologist to cover that for them, especially for insurance purposes. A lot of times it can take 6 months to a year for a client to even get into an office to see a neurologist. So we can simply do a thorough assessment, determining where the migraine starts and where it ends, the signs and symptoms that occur with those migraines, and try to fit a service that is meaningful for them. Because yes, Botox, Dysport, Xeomin can be used for cosmetic, but it also can help relieve pain and discomforts, especially TMJ. Considering TMJ, there's a couple assessments that I make just to consider, like if they're wanting to treat masseters, I want to make sure, considering jowling and whatnot, if they have the actual symptoms of TMJ or if they're just wanting a slimmer jaw. But just in that sense. But there's also, to treat pain in the traps, or it's known as Barbie Botox in the traps. But yeah, you can use it for a lot of other sort of treatments besides just cosmetic.
Absolutely. And Paloma, so I know corrugator muscle, so put it into language. Those are going to be the furrows or the 11s in your brow. But what are the other areas as far as in the aesthetic side that you see most commonly that you like to treat? We've got, crow's feet or baby Botox underneath the eyes. What do you see most commonly? That's probably a question for all of y'all.
Well, I see the glabellar complex, which is the 11 lines that most people complain about, but definitely crow's feet. So the lines around the corners of your eyes, and the frontalis muscle, which is essentially the top part for your entire forehead. There's also off-label uses. I'm not sure if we kind of want to get into that, but you can use Botox for masseters, so the muscles in the back of your jaw, which you use to chew. Also areas like the chin, but on-label use would be crow's feet, glabellar complex, and the frontalis.
And there's also one, if I'm not mistaken, it's the depressor angularis. When people have that downturn lip, kind of like, I hate to say it, but fish face, like at the, you can help soften that a little bit too. But anyway, so there's lots of use. Botox is actually a beautiful invention that has helped lots of people and also has been proven aesthetically to help with intrinsic or inside aging factors. All right, a couple of questions coming up. I'm going to go ahead and go back to Jay. And Jay, approximately how soon will the client see result using botulinum toxins of their choice?
So usually, now, I mean, it's gonna be between 4 to 7 days. Usually this pour, it take action really quick. So after 2 or 3 days, the person's gonna start to see the result. Now we have this new molecule on the market, is the Xeomin, which after a couple of days, the client actually start to see the result. But I always make sure to explain to them, because I have client calling me the day after getting the treatment done, asking me why this is not working. This is not working right now. I mean, it's been only 24 hours. So you're gonna start seeing the result after the third day, usually between 4 to 7 days. 7 days, you see a good result, but you're gonna see the final result on day 14. So it start kicking once we inject it, but it's gonna keep kicking or working until day 14. So that's when you see the final result.
Beautiful. And about Jay, back to you again. How long would you say the effects last? And does it matter which product that you use for the effects?
So, the theory says it lasts between 90 and 120 days, which is 3-4 months. But also depend of the person. Everyone is different. So for some people who has like high metabolism, who work out like really hard, like every day, they go to gym like every day, it can last a little bit, less. I would say like 2.5 months. But some people, they can last a little bit over 4 months. Everyone's different, but in average 3 or 4 months. Never. I mean, in some clients, they expect Botox to last for 6 to 9 months or a year, like fillers, but no, that's not true. So let's stick with 90 or 120 days, 3 or 4 months.
Perfect. Awesome. All right, moving on to filler. Let's go ahead and just a brief overview of what filler can do. I know we have more than the hyaluronic acid fillers here, but Amber, go ahead and tell us. I know that we briefly talked about loss of volume, but you can see some of our Novuskins before and after images here about what we're able to do and restore the face with fillers. Tell us a little bit about your fillers and what are the most common areas that you treat, Amber?
So I am obsessed with lips. I love doing lips, and it could be genetic or it could be related to age that we do lose, laxity of the skin. We also experience bone loss. So providing just, beautiful plumpness. I love treating cheeks to help provide volume back into, or to help with structuring, especially when it comes to if you have a significant jowling. Putting a little bit of filler can kind of provide more symmetry to the face and provide beautiful results. Chin filler is great too, because we do experience bone loss as we age, and putting a little bit of filler helps with the contouring and also helps with how shadows fall whenever we are, in certain lighting, to where it can give more of a heart shape for women, or angulated. But there's also, you can place filler in the jawline, just to help when we're needing more structure, more angular structure.
So beautiful, cheeks and lips. Paloma, tell us a little bit about what's your favorite place for fillers, what your experience is, and kind of give us a little insight from you.
So I started off using hyaluronic acid filler mostly in the lips. But as I gained more confidence and experience, I moved on to full facial balancing. So I really use it in the mid face, lateral cheeks, jawline, chin, all of those areas, nasal labial folds. I pretty much use it anywhere where it's indicated. I do like biostimulators a bit more, so the two that would fall into that category are Radiesse and Sculptra. Radiesse works as a filler, but also has a biostimulating effect, so it helps reproduce lost collagen and elastin. So I really like Radiesse because of that. But Sculptra is another great biostimulator that can be used in the face as well and other areas.
Paloma, staying with you, how long typically do fillers last? I know this greatly depends on metabolism, but a best guesstimate and which type of filler usually lasts longer. Could you give us some insight into that, please?
Right, so it does depend on the manufacturer, but typically fillers last about a year. Some are manufactured and made to last a little longer than a year, but I would say for the most part, fillers should last at least 1 full year.
Okay, beautiful. And can they be combined with botulinum toxins or Botox, laser therapy to enhance results? Tell us a little bit about how you treat the whole face, not just the areas of volume loss with fillers.
Yes, so that is correct. You can definitely combine with other treatments in order to get optimal results. I typically have clients that get neurotoxin, so Botox, Xeomin, or Dysport regularly, and also get filler along with their treatments. You can get Botox and filler the same day. However, for some laser therapies and facials, for example, I usually tell my clients that get Botox or neurotoxin to wait 2 weeks after the neurotoxin to get laser therapy if it's on the treatment area or a facial. But you can combine with other treatments, and I think it's the best way to do it in order to achieve your goals with aesthetics.
Perfect. All right, Jay, back to you. Tell us a little bit about how you go about encouraging your client to choose the right injectables, because we have so many on the market. We have so many things we can do with them on label and off label. Is there a science to your beautiful madness, or or is it just right up knowledge that you have stuck in that brain? Tell us a little bit how you choose the right injectables for your clients and assist them in choosing as well.
So usually when if I have a client that they have never done anything on their faces, so they come here for the first time, I rather use the no long-lasting fillers like Radiesse or Belafil or stuff like that. We don't offer Belafil, but just an example. Just hyaluronic acid, so they can have an idea, how they're gonna look or the result that they're gonna have. And after that, and maybe in the next session, after 6, 9 months or a year, we can use a long-lasting filler. Because obviously, like it's gonna last a little bit longer. They're gonna have a beautiful result. So that's usually what I do. I starting always with hyaluronic acid.
Perfect. So taking it one step at a time.
Yes.
All right. Going back to Miss Amber, tell us a little bit about this topic. Triggers your natural collagen production. Take it away.
So Radius and Sculptra are phenomenal biostimulators. Whenever they are injected, they send signals to cytokines in the body to regenerate collagen in that area. So whenever they are reconstituted, they are reconstituted either with a saline or a sterile water. Whichever is specific to that reconstitution method. And your body will absorb that water. You'll see a little bit of swelling for a day or two, and then you'll excrete it through your kidneys. And then the cytokines get to work, and then messages are being sent throughout the body. You can start noticing results within 2 weeks. But optimal is 3 months of really noticing the results. A lot of times it would be, your friends are going to notice in 2 weeks, but you're going to notice in about 3 months, and the results can last from 1 to 2 years, maybe even longer.
Tell us a little bit about what cytokines are. Are there's like the master cells in the body for the other people that are like not science? Tell us,
Sorry.
what are you talking about? Tell us what that means.
I'm sorry. They're like little messengers. So they're division of the cell. That's probably a little too. And it goes into mitosis and meiosis, and like makes me think of like the mitochondria is the powerhouse of the cell. But it's basically just a fancy way of saying, hey, we're sending messages to your body to start working where you used to have that collagen. So it's the kinetics of it, or the electricity of it, like firing signals to regenerate where it used to be.
Perfect. And Paloma, we're going to you. Tell us a little bit about Kyabella. This is a topic. We know that it's an injectable and it's not technically a filler. So tell us a little bit about this product.
So Kybella is essentially deoxycholic acid, which is a bile acid. So it helps destroy fat cells, and the on-label use would be submental fat, so the fat underneath the chin. So it's great for anyone who has a little bit of extra fat that they really can't get rid of because it can be hereditary, and no matter how much diet or exercise you do, that area does tend to have a little bit of stubborn fat. So it's a great product for that area. That would be the on-label use. You can also use it off-label, and I've used it off-label, to target like the bra fat, back fat, a little bit around the love handles. I do like that product because you can use it off-label in areas that, if you don't want to get liposuction, chin lipo, or lipo for those little stubborn areas, I think Kybella is a great product for that.
And typically, I guess this is kind of a hard question to answer, but I'd like to know, we get this question all the time, how many treatments will it take? But to answer my own question, y'all guys correct me if I'm wrong, but it depends on the amount of adipose or the amount of fat cells that we're actually treating. Is that correct?
Yes, I would agree. That's correct.
Yeah. So usually 1 to 2 or 1 to 3 sessions?
It
I
depends
have
on.
mine. Oh, go ahead,
Sorry.
Amber.
I'm so sorry, Paloma. I was going to say it depends on how much you initiate in the first treatment. So if you hit it hard with the first treatment, you may not need that third treatment. So it just depends on how many vials of the Kybella that are used during that initial treatment. And then whenever you do follow-up, then the client with the injector can determine that if there's a second or a third necessary.
Perfect. And Jay, we're going to go back to you. Jay, tell us a little bit. This is like masterful artistry is Sculptra. That's what I like to call it. Tell us a little bit about Sculptra. I know, and what's the difference between Radies, is that if I'm saying that correctly, and Sculptra? Tell us a little bit about what's the difference between the two, and then the BBL. We're going to talk about that later in the slide, but I know that that can be something to help with like hip dips, be something to increase volume and the glutes, so on and so on. So tell us your take on Sculptra, Jay.
Yeah, you know you say you meant to say radius in the sculpture. So the radius calcium based filler, and it's also like biostimulant, like Paloma said before. They both is gonna push your body to build new collagen type 1, type 3, and also lasting. And you get a great results with both of them. The thing with radius, I will say to you guys, I mean, the clients are gonna get like results right away. With the sculpture, um, probably the client's gonna see results a little bit later, um, um, like we said before, with the sculpture, probably, probably your family, your friends gonna see result in about 2 or 4 weeks, and you're probably gonna see a result in about 90 days, because it's usually the time that your body is gonna take to produce new collagen and elastin. And this is a great product because you can use it, on your face. We can do it in your butt. We can use it in different parts of your body. And what it does is gonna, create more volume, because we're aging, we're losing collagen and elastin, we're losing volume. So the skin is starting to lose a little bit less saggy. Some part of the face starting to show like fine lines, fine wrinkles that usually bother the clients a lot. So then, look, it's the middle and the lower face. We can use Sculptra. We can use it for we call the BBL. I wouldn't call it BBL with the Sculptra, because it's just like butt lift, because it's gonna create like more volume. It's gonna make it more rounded. We can use it for like hip dents, or for cellulitis. Sometimes we have little dimples right there that also as a main concern for one of my clients list. So we can use in those areas and just we try to create more volume and make everything to look nice and more rounded. Talking about the lower part of your body, the glutes. And usually, so what I do is I offer the clients to do the treatment. We can do a follow-up in about 2 months and see the results. Wait until 90 days and start to see the result. But the ideal of this is just try to do the treatment, to repeat the treatment every 4 to 6 weeks, at least 3 times, just to get the better results. It's also going to depend the amount of vial that we're going to use in the clients. It's up to, it can be face, temples, or cheeks, or in the butt. So it depends. The results are going to depend of the amount of vial that we're going to use.
Perfect. Yeah. And one thing I like to say about the temples is, as we age, some of that fat pad or the fat around our temples or our upper forehead likes to migrate down. And Sculptra is a great alternative to help with that, in my opinion. And I've seen some great results from all of the injectors or all of the panelists today. Y'all guys are outstanding. So coming up next, and I'm going to get to all of y'all to talk about PDO threads or thread lifts. It is probably my favorite subject to talk about, because the results are just absolutely outstanding, and they're pretty instantaneous and long lasting. So I'm going to go on to the next slide, and Amber, go ahead and introduce us to thread lift, the advantage of using PDO threads.
Absolutely. So we utilize mint threads. So that stands for minimally invasive non-surgical threads. They are made up of PDO, which is polydioxone, and we have mono threads, which are smooth threads that can help with addressing fine lines, like smile lines or even lines of the glabella. It can also help with like jowl linked, because with the smooth threads, it will send alerts or signals to the body to regenerate collagen in that area. With mono threads, it can take a couple treatments to address those specific areas, whereas with the mint barbed threads, those are lifting threads. And those threads have a multi-directional barb that, once they're placed, which can be in the mid face, and the jawline and the brows. I've done threads in the breast for a breast lift. You can place them in the buttock area for a butt lift. But these multi-directional threads, when placed, can help with lifting, as well as contouring. And the threads dissolve in about 6 months, and what's being regenerated is collagen from the polydioxone. So when those threads get, when they're dissolved, what's holding that tissue in place is new regenerated collagen, as well as some scar tissue. And they're placed under the skin in the fatty area of the tissue. And the results can last from 1 to 2 years, but if maintained, can last a really long time. A great alternative to a facelift, a neck lift, a breast lift under the knife. So.
Absolutely. I had my PDO threads done probably about 3 years ago, and I'm still seeing the results of them. And it was just absolutely outstanding. So Paloma, I'm going to let you take a little bit and tell us what is your favorite, I'm going to say vector, and then we'll get to all those cringeworthy moments. I'm sure everyone's like, oh, this is so scary. It's not near as bad as you think it is. And hopefully one of y'all can talk about what the smash layer, the SMS layer is, and the pain and what the recovery time is. But Paloma, I want to hear from you. Tell me, are you a cog girl? Are you a smooth thread girl? And what's your favorite place to treat with threads?
So, I would love to jump in. Sorry about that. Sorry, Paloma. So I would love to answer those questions for you right now. I agree with Amber. We use a PDO thread. There's so many brands on the market. I think some of them are better than others. I think Mint, the ones that we offer, are great. We get a great result. So what Amber was saying, we place them underneath the skin. Some people, they think it's gonna go and into the muscle. We're gonna lift the muscle. That's absolutely not true. Some people also, they're expecting to get like face and neck lift, like completely face and neck lift with PDO threads. So that's also a false belief, because it's gonna give you just a lift enough for you to look good and for look more young. Usually, like Amber said, they last for at least 6 to 8 months. Your body's gonna get rid of them. So the material is the same material. How to explain that to my clients? This is the same material of the suture that we use for surgeries. So your body's gonna reabsorb them like completely in about 6 to 8 months. But in the meantime, your body's gonna be building new collagen. And the procedure actually is really like we said in the beginning, it's a minimum invasive procedure. I would say it's not painful, but it's a little bit maybe difficult and not difficult. A little more work in the beginning is just the local anesthesia. Lidocaine can be sometimes a little bit annoying, but just doing the little poke on the face, that will be the maximum pain that the client can feel, the maximum discomfort the client can feel or can experience. But after a couple of minutes, that's completely numb, and it shouldn't be any pain, like absolutely no pain. You can feel a little bit pressure, but it shouldn't be any pain. So what I also explain to my clients, we need to know if they have any medical condition, like, their diabetes, or taking any medication, like blood thinner, like Coumadin, Plavix, Eliquis, or they're taking fish oil, vitamin E, or something like that, or they smoke, or they drink a lot of alcohol. They need to stop always at least 5 days before the treatment, because that can increase the risk of, bleeding or bruising, and we don't want that happening. The procedure is pretty simple. It can last from an hour and a half, and the client can easily go to work after the treatment without any problem, without any issue. Maybe they can get a little bit swollen, but it's not going to be a big deal. And the recommendation after the treatment is just avoid the big movement, like like eating a hamburger, or yawning, or laughing, and to sleep on their back at least for the next couple nights. If they cannot do it, that's fine. That's completely fine. And they're gonna feel, maybe they're gonna feel like tender for the next couple weeks. But if you take Tylenol or ibuprofen, if they're not allergic to, everything should be, okay. Also apply some maybe arnica over the skin. We don't recommend massaging, and also apply some ice. It should be more than enough to, but the client shouldn't be experiencing any discomfort or anything like that, or like huge pain. It's a pretty easy procedure, and you get a beautiful result right away. But also, it's gonna look even better with time, meaning that your body's gonna take maybe after 4 or 6 weeks, your body's gonna start producing new collagen. But after 3 months, when you see better results, sometimes we have clients say, "Oh, I didn't see that much in the beginning." No, just wait, just be patient. You're gonna see. Yeah, you just said it that you had your video threads done, a while ago, and you're still seeing like beautiful results, and that's the magic of the threads.
Yes, I agree. And magical is 100% for sure. I love the looks. In fact, we have our before and afters online at novuskin.com that you can see some of our actual patients that have given us permission to post their before and afters after PDO threads. And this is just one of those things that just helps and continues to help. Sure, every 3 to 6 months, you probably won't need to get it done that often, but I will say it's something that lasts and continues to benefit you long after the procedure. So moving on, speaking about things that are analogous and that can continue to benefit you over a long time, let's talk about platelet-rich plasma and also platelet-rich fibrin as an injectable. I've also heard of this as biofiller. One of the experts, y'all guys, go ahead and take this away. Tell us a little bit about biofiller versus and platelet-rich plasma.
You want me to start?
It's fine. I was
Sure,
like,
I'll
I was
go
hoping
ahead.
one of y'all would jump in there, but girl, go
I'll
for it.
I'll start. So platelet
Okay.
rich plasma, it's actually it's one of the procedures I love doing, especially when I have clients that want a more natural look. They might be a little apprehensive to like, I'm not quite there yet. I'm kind of dipping my toes in the water. When it comes to aesthetics, I'm like, well, why don't we just use what you already have? And that would be drawing your blood, spinning it down, and utilizing that liquid gold that you provide. And you can put PRP anywhere. I place it under eyes for a natural look, especially as we age, we lose a lot of laxity in our under eye. So I will utilize this and as an alternative to filler because it lays beautifully. You can place it in cheeks for cheek filler. You can place it in lips for lip filler, and you can address fine lines in the neck, breast lift, butt lift. You can actually inject it in joints as a pain blocker because PRP has a lot of great antibodies and growth factor. And whenever it is placed or it's injected, your body is sending a signal to the body. And it's like, oh, hey, I remember you. Let's start working together. And let's recreate that collagen that used to be there. So the PRP sends the inflammatory response to the body, and it's like, oh, let's work together. Let's make this happen. Let's make some collagen and let's make beautiful, lasting results.
So I have a quick question for Paloma. So I have heard this, and I could be incorrect. I am not a injector. I'm just an advanced esthetician. But sometimes filler in very light Fitzpatrick's can cause like a blue cast when injected underneath the eyes. Is that why we would switch over to platelet-rich plasma, or is that an incorrect knowledge base on my side?
I think that actually depends on the individual's anatomy and their vasculature. If they have very thin skin underneath the eyes and they are fair skin and you can see the blood vessels, then it is a possibility. But I've also had fair skinned clients that have had tear trough filler or under eye filler and it looks just fine. So I think that depends on the individual, but I would personally choose PRP or PRF versus filler in a client if they're looking for more of a natural result and if it's their first time getting any sort of injectable done. So if they're filler naive, I would probably go with something like PRP or PRF in the under eyes versus a filler.
And just to make sure I'm on track as well, platelet-rich plasma has our own cytokines in it, correct?
Yes, that is correct.
Awesome. Okay, let me go to the next slide. Paloma, you want to take this away and talk combining platelet-rich plasma with our outstanding machine. And I will say this, maybe Morpheus 8 is probably one of my most favorite treatments there, because once you combine it, let's say 2 years out from a PDO facelift, Morpheus 8 just likes to come in and give you that lifted, toned appearance. And then if you can put cytokines in it, let's talk about combining those two powerhouses together. Paloma?
Sure. So I think this is a great example of using multiple modalities to achieve a great result. So when you're using Morpheus 8, it's radio frequency microneedling. So you're really using that to kind of stimulate collagen production, tighten the skin with the radio frequency aspect that you mentioned. And then when you combine it with something like platelet-rich plasma, or what some people call liquid gold, you're using all of those growth factors that are present in the PRP to enhance the result and really help with the tightening and boosting the collagen in that area. So it just helps kind of speed up that collagen production and cell renewal.
Perfect. That is a great answer. And I think I know right now we have sales going on for Sculptra. We also have sales going on for Morpheus. So y'all guys look on our website, all of the different sales are up for those. And these are actual real client results, which is outstanding and exciting. We're going to go over to some common questions. Jay, will you go ahead and take care of these questions? What sets PRP apart from other skincare treatments? And is PRP safe, and are there any risk to it?
Okay, let's answer the question. Last ones, but PRP is super safe. Like Amber says, something that belongs to your body. You shouldn't have any reaction or any interaction with anything in your body because that belongs to you. And I will say one of the risks is just, I mean, it's also depend of the experience of the injector, but you can always have some risk of little bleeding or swelling or bruising, but no more than that. And what sets a PRP apart from other skincare treatment, it just belong to your body. It's completely safe and natural. So, and like Paloma said in the beginning or before, so when we have a client who comes here for the first time, they're virgin, they never had done anything or use any type of product on their body or on their face, PRP is always a great option to start, any treatment on their body, on their faces.
Perfect. Yes. And I love it, watching it and seeing, there's so many telltale signs about watching that blood draw and seeing, how the condition of the human body. But anyway, we're going to move on to the rage, the Sculptra butt lift. And Miss Amber, would you tell us a little bit about this? I know we touched lightly on it. We're just going to go back and touch one more time. And this one will kind of breeze through a bit because I want to get to what the difference is between good results and what bad results are. And how to choose the right injector. I mean, y'all guys, we already know we're going to choose you, but you do need to know your stuff. So we're going to talk a little bit about that. Okay, go ahead, Miss Amber.
So when it comes to choosing an injector, I mean, it's as simple as just scheduling a consult and, having a honest conversation with your injector, like, hey, how long have you been doing this? Can I see some pictures? Actually involving you as a client in discussion versus, oh, this is what you need. I mean, I am a very animated kind of person. Whenever we're having a consult, I have a pen, I have a ruler. I mean, I'm taking pictures and I'm thinking about, like, I need to address this area. How do you feel about that? And then you are involved in your care because you're walking around with my art, and I want you just with the complete satisfaction of what you've received at Novu Skin is what you desired. When it comes to Sculptra, I mean, yes, I do a combination of the Sculptra with Radiesse because the Sculptra does help with regenerating the collagen. But the Radiesse helps with volume. So if we have like divots or if we have hollow spaces, I will combine those two treatments together um, to give you the optimal results for the for what you are in search for, that does not require going under the knife and downtime and whatnot. This is a procedure that can be done in 1 to 2 hours, and there's no downtime. You don't have to, rest. You can go back to work that day.
Which is a huge comparison to going underneath the knife. Not that I'm slamming it, or
Oh,
saying anything negative about it,
no.
but that is it. To be able to go back to work the next day is something absolutely outstanding. So Paloma, I don't know if you've had, as a consumer, so I'm a consumer, how do we navigate the terrain of finding the right injector? Is it personality? Is it outstanding note taking? What makes an injector really great in your opinion? And then Jay, the same question to you in just a few minutes.
So I think a few characteristics of a good injector are someone that has experience and knowledge, and of course aesthetics, and is also ethical, and is just a good listener, because you can go to a great provider that is used to treating everyone the same and won't listen to your individual needs. So I think it just comes down to finding someone who's willing to listen to what your goals are and help you achieve those goals realistically. And also someone that's willing to say no whenever, maybe you want too much filler, or kind of encourage you or lean you towards getting something that will look more natural or more based on your needs and goals versus
Yes,
just selling something.
as displayed so lovely on our on our screen. I was like, whoa. Jay, tell us what, in your opinion, what makes a good injector? I know it's an aesthetic eye, the love of science. Tell us a little bit about what makes you
Yeah,
who you are.
absolutely. Experience is very important, but I always say that everyone can inject. Everyone can inject, but you have to know the knowledge. You need the knowledge, and you also need to have the aesthetic eye. You need to pick the right client, the right product, the right amount of product, and place it in the right place. So, there is a difference with when the client comes to me, for example, and I love listening to my clients, but sometimes what you want is not what you need. So you can present your concerns or what you want, but let's meet in the middle. So, and I want to tell you what you need to look good. And I completely agree with Paloma. Sometimes people are, it can be addicted. Sometimes people want more, they want more, but they don't need more. So we don't sell products like you said in the beginning. We sell beauty, and I just want the patient to look good. They are my business card. So when they go out there, they are gonna look good, and everyone's gonna ask them who did that. So that was Jay from Navuskin, or that was Amber, or that was Paloma from Navuskin. So they are our business card. So we want them to look good, so we look good too.
Perfect. Yes. And all of y'all, I just have to say this. Maybe this is the Libra in me, but you are all gorgeous. Okay. Yes. Let's talk about what has just revolutionized the weight loss industry. So we're going to talk about semaglutide and tripeptide, if I'm pronouncing that correct. And Jay, you want to go ahead and talk about semaglutide for us?
Yeah, sure. So now the semaglutide is a medication, it's a GPL medication. We don't have to go like to technical medical right here, just for everyone to understand. The semaglutide is a type of medication that we use for people with diabetes, but it can be used off label for weight loss. So basically what it does is an appetite suppressor. It's going to be your appetite low. It's going to be your blood sugar low, which can be a side effect of semaglutide. So sometimes if you are not hungry, you're going to forget to eat. You cannot forget to eat because you're going to feel sick, because you're going to feel dizzy, you're going to feel, tired. It also helps your cholesterol, bring your cholesterol down, and also help to burn the peripheral fat, and I call this stable fat. And, it has some side effects, basically gastrointestinal side effects, can cause vomiting, nausea, acid reflux, burping, cramps, constipation, sometimes diarrhea. But to be honest, just information, because in my experience, my clients only complain of a little nauseous here and there, and sometimes constipation. That's why they need to drink a lot of water, just to make sure that everything is good, and just increase the intake of fiber. And if they have any side effect or any allergy reaction, they just need to contact their provider just to take care of it.
Can you tell us a little bit about how the semaglutide is administered, where you can receive it? And we did talk about lowering their cholesterol levels and some of the other benefits. You can touch back on that, but where is this medication administered and how often do they receive it? I know at Novuskin Spa, they also receive B12 complimentary with their package. So tell us a little bit about these questions on the screen today.
That's correct. It's just a weekly injections. It can be done around your belly button, also in the back part of your arms. We started with the lowest doses, 0.25 milligrams per week, just a weekly injection again. And every month we're going to increase the doses. The beginning is just because we want, your body to get used to this medication and avoid the side effects. We cannot start at the highest dosage because you're going to feel sick, and that's not the goal of using this medication. So every month we're going to go up, basically double. We're going to increase the doses double, 0.25, 0.50, 1 milligram the third month. 4th month we're going to go 0.27 in the and the 5th month, we're going to go up to 2.5 milligrams. And that is the highest doses that the client can receive. And like you said before, too, we are offering the combination vitamin B12. It's going to make them feel a little bit of energy after the shot, like couple days or 3 days after the shot. Is a great option for the clients. And yes, absolutely, it's going to help not just losing weight, because when you lose weight, and this is also helping with your cholesterol, probably your blood sugar level is gonna go down, and also if you're having a high blood pressure, losing weight is gonna help you to also to bring that blood pressure lower, and probably at some point just so you won't need to take any medication for your blood pressure, but that's something that they have to discuss with their provider, the cardiologist or the internal medicine doctor.
Perfect. Okay, I'm going to step forward in the slide for just a second because it is giveaway time, and we still have lots of other topics to talk about, and following also a Q&A. But we want to make sure that everyone participating today definitely gets their $50 towards injectables of their choice. And then also, if you don't mind, please go ahead and text webinar with your first and last name to 877-NOVUSKIN. Once again, that's webinar with your first and last name to 877-668-8756. One grand prize winner that will be named and just at the end of the webinar will receive up to 600 units of Dysport. That is a big gift. And everyone, y'all guys are going to receive $50 towards the injectables of your choice. So going to go ahead and text once again, text webinar with your first and last name to 877-668-8756. And Amber, while they're texting, tell us a little bit about the other options that we have. I know we have semaglutide, but we're now offering tirzepatide. Or am I pronouncing that correctly? Tell us a little bit about that.
So tirzepatide is another injectable. It's a weekly injectable. I love tirzepatide because it is kind of it's like a step up compared to semaglutide in the sense of there are side effects that can occur with semaglutide, especially when you first start it. And with tirzepatide, you do not have those common side effects such as nausea, vomiting, diarrhea, constipation, reflux. And also, you have the potential of losing weight much faster. So, with semaglutide, when you're starting the first 2 months, you may lose about 1 to 3 or 2 to 4 pounds each week. Whereas with tirzepatide, in the first 4 weeks, you're losing about 3 to 5 pounds. So, a lot of times, this is for my clients that are like, I need to get snatched for summer yesterday. And I'm like, well, we need to go ahead and start the tirzepatide now. So, I love it. It's great. It's definitely, whenever I'm consulting for weight loss, I discuss both of them because I think they're both wonderful treatments that we offer.
So they can lose up to 21% of fat loss in 12 weeks with the trizepatide, and it curbs cravings, it boosts metabolism, no exercise required. I mean, I am a walk it girl. Like of course, at least walk, move your body a little bit. But there's
Absolutely.
yeah. And then tell us, how does trizepatide compare? Well, you did go ahead and go over the comparison between semaglutide and trizepatide.
Well, another way that you can also consider it is like if, and there are those unfortunate circumstances if a client may plateau in the semaglutide. It's not common, but it can. This is a little bit of ammo that we have in our back pocket. Well, let's try the tirzepatide and see what other results that we can obtain, because when we're losing weight after mid-30s, our hormones are playing a huge effect in that, especially if we're menopause or postmenopausal. Our hormones can definitely affect how we lose weight as well as our metabolism. So, that tirzepatide is a different buffer that can help continue with that weight loss journey, despite all the other cofactors that are involved.
Perfect. And is there a BMI cutoff for trizepatide? Like, I mean, I know we get some people in there that probably don't need this. Do they have to be larger than semaglutide, or it's really just their choice?
I've never been a fan of the BMI. I don't follow it. I've never followed it in any of my practice as a nurse practitioner. It's about how you feel, as well as maintaining quality care as well as safety. Now, if I have somebody that comes in that is anorexic, I am going to decline. However, BMI is a scale that it wasn't meant to be followed in certain aspects. It's about how you feel. It's about how your clothes feel, and it's about the confidence that you want to instill in yourself. So this goes down to more of a one-on-one discussion with that provider and that client to determine, if this is what they, if they meet those standards.
Perfect. Thank you so much. And I do want to talk about the skinny shot, because we have a lot of people, Paloma, that are on our wellness program, and people ask for the skinny shot all the time. So can you tell us a little bit about what the skinny shot is? Can it be in combination with semaglutide or trizepatide? And how quickly people can expect results from either the skinny shot alone, which I think 2 shots a month is something, around $50–60. Don't quote me on that. And then, so just tell us a little bit about what people can expect with the skinny shot.
Yes, so the skinny shot is different than semaglutide and trizepatide because it's not a GLP-1. However, it can be used individually. We have clients that use just the B12, that get the B12 weekly along with their semaglutide or trizepatide shot. But essentially, the skinny shot is just B12 and lipo-C. Lipo-C is a compound that essentially helps with fat burning in the body. And the B12 is a water-soluble vitamin that can help with energy levels. It also is great for individuals that are vegan that cannot obtain B12 from animal products. And it can also help boost the metabolism and form new blood cells, red blood cells specifically. So it's great for anyone that is anemic as well. So if someone is hesitant to get on a GLP-1, such as semaglutide or tirzepatide, I would say the skinny shot is a great start. Is it going to necessarily decrease your appetite like semaglutide and tirzepatide will? Probably not, but it will be a good boost.
Perfect. Thank you guys so much. Okay, we're going to go over to the Q&A while we're waiting on the grand prize winner. So I'm going to open up the chat. I apologize if everybody can see my screen, but we're going to start with some, let's see, everyone's like, okay, my stuff is not working still. What will be expected of me to get the best results? So I'm not really sure which one that was, but let's just talk in general. What are the best results for home care after any type of injectables? Go ahead, Amber.
So I love telling my clients, if it's like neurotoxin, I recommend taking zinc daily. That can help with your neurotoxin to last a little bit longer, but it's hydration. What you consume will show on the outer part of your skin, getting a good night's sleep. Antioxidant rich foods. If we tell you not to massage, do not massage, leave it alone. As when it comes to fillers, things are going to look a little sketchy for a couple days. There's going to be bruising, there might be lumpiness, tender spots, but within 2 weeks, all of that resolves. But cold compresses and certain treatments, a lot of times I will give like a little cold compress to take with you, depending on what you receive. But it's about maintaining a healthy well-being. So diet and exercise, antioxidant rich foods, drinking plenty of water, sunscreen is your bestie, always, and yeah, taking care of yourself.
Perfect. Yes. And I love that you mentioned zinc. So we actually offer that with our nutraceuticals, our IV wellness as well. So what are the side effects? We covered some side effects with the injectables and also with both of the weight loss programs. So we have a question as far as our derma fillers expensive, and it really greatly depends. One, we have a sale going on. And this could be specific location, but it's usually buy one, get one for $1.99 of your derma fillers. So we always are running specials each month. They change. So they're not incredibly expensive. And then Paloma, I have a question from a Lucy. That she wants to know if we can use some of these on her hands. She's done 4 to 5 different treatments of sclerotherapy. That's going to be for spider veins. And she doesn't know if maybe she needs a filler instead of doing like a saline injectable treatment. She wants to know if there's anything that we can use to help with hand rejuvenation.
Yes, so Lucy, we can use a product like Radiesse or even a hyaluronic acid filler for the hands to just restore and replenish volume in that area. I've used Radiesse Hyperdilute in that area and it looks very natural and also fills in the area. So yes, we could use filler.
Beautiful. So filler, even, you know what, even platelet rich plasma, it can be great for the back of the hands too. You may get a little bit more volume if you're losing volume from the from radies and different things like that, but platelet rich plasma can also be used to help as well. Let's see. So can you talk about the heaviness that can be expected after neuroinjections on the forehead? I have actually never heard of the heaviness, but let's talk a little bit about the heaviness. Jay, if you're available, let's talk about the heaviness because I want Dysport to be used for TMJ. I'm going to pass that one over to Miss Amber.
Yeah, actually, I mean, that's one of the side effects that the clients can, expect after doing a neurotoxin. usually this part is the one who causes more like heaviness. It can be experienced for the next couple of weeks after the treatment, but usually after 2 weeks it should go away. It also depends on the amount of units that we also put in placing in the forehead, and also the technique that the injector is using. If we go too low, it's gonna cause more, like heaviness, heavy sensation, but it's something that can be expected. Not everyone experience. I mean, I've been doing my Botox, my neurotoxin since I was, I think, 27, 28, something like that, and I still experience the heaviness for the next couple of weeks after doing my own treatment. But like I said, not everyone experience the same. But it is described, so it can happen. But it's nothing wrong with it. As long as it's not causing any droopiness and anything like that, everything should be good.
Perfect. And then I do want to talk about this one with Amber, TMJ, lockjaw. Can Dysport be used for that, or is there a particular neurotoxin that you like to use for that area?
Dysport can definitely be used. I prefer Botox. That's just my preference for TMJ. And usually when I'm utilizing Botox, if this is an initial treatment, I may start at 20 to 30 units each side, but it also depends on the client's anatomy. If they do not have TMJ, and they're just wanting slimming, and if they have significant gelling, I wouldn't recommend it, because then that can bulldog that client. So it just really depends on, when we're assessing, we're seeing the depth of how tight that muscle is to determine, approximately how much we would use. But yes, Xeomin, Dysport, Botox, they all can be used in that area.
Perfect. Okay, guys, we are ready for the grand prize winner. I am so excited to announce that our grand prize winner is Miss Cindy Roberts. Congratulations, Cindy. Yay.
Yes, Cindy.
Yes, and everybody, don't forget, those of you that have participated in the webinar today are going to get $50 towards your injectables of your choice. And once again, our grand prize winner, winning up to 600 units of Dysport, is Miss Cindy Roberts. We are so incredibly happy to have you. We were happy to have all of y'all. And I want to thank each of our panelists. If y'all guys have anything in closing to say, please go right ahead. It was my absolute pleasure to speak to some outstanding aesthetic nurse injectors. And it was really illuminating and eye-opening. So thank you all so much. Jay, outstanding. Amber, wow, a wealth of knowledge. Paloma, what a great individual. Y'all guys, share your feedbacks, share your joy. This is celebrating you two as art of the injectables.
Thank you so much for hosting us, Katie, especially
Yes, thank you.
with all of the computer stuff.
Yes, exactly. Thank you guys so much for staying to the end. And once again, I want to welcome you to Novu Skin Spa. Y'all guys come in. If you're not a current client of ours, get your booty through the door just to say hello. It would be our pleasure to serve you. We are truly in the service industry, and it was our honor to tell you a little bit about the artistry of injectables. Look forward to next month. You can always find us at social media at Novu Skin Med Spa. You can find us at novuskin.com. We're on Instagram. We're on YouTube. You name it, we've got the channel, and we are ready to assist. Any more questions, please don't hesitate to reach out to us. My name is Katie, and this has been the Artistry of Injectables. Thank you so much. Have a lovely day, guys.
Thank you all. Take care.
Well.